actually. It's very great to meet you after a long time. We just meet during the team meetings and all. So thank you, Sonanda. So we can just start this session actually. So I think you all get a brief idea about what is palliative care yesterday by Dr. Deepak, I think. So he was very good with his topic and he's very good in educating others too. So I think you all get a good knowledge about palliative care and what we do in Palliative India. So for that, I think the second part is mainly communication in palliative care. So I'll just share my screen. Okay. So communication in palliative care. So as we know, communication is an important aspect because without communication, nothing happens with everyone. Okay, so it was Narayan. Okay, sorry, Narayan. So we'll just skip the first part. Like you can see here, you can see the picture of our Dr. M.R. Rajagopal sir. So I'll be going with his ideas and all, and his experiences, what he shared with us, and what we went to when we visit home care and all, what we have learned, and that will be the sharing and the content of this session. And I know that you all are very interested in this topic and in palliative care, and with all the all the persons who are gathered here. I think you all are working as a volunteer, so it's very important aspect of palliative care. Not only the addition of doctor, nurses, or social workers, volunteers are actually the core of palliative care to reach out to the most needed persons. So I'm very grateful to have a session with you, and so we'll just move on. So simply asking, what is communication? So firstly, I want to tell you just you can just communicate with me too. If you have any doubts or if, anything, I'll just share to you. You can just ask me, no problem. And you can use it via chat box or via asking me with unmuting yourself. Okay. So what is communication? Simply asking. Anyone who can unmute and tell me what is communication?
It is a process of giving and sharing information.
Yes.
And making sure that whatever you're trying to convey is conveyed in the same context as it has to be.
Yeah, thank you, Vinita. So this is actually a simple picture. It depicts like what is communication. Like a person or a sender will be there, a receiver will be there. So his ideas or things will be shared through a medium with the use of a voice or any other mediums. So that's simple communication. So here you can see that one person is telling something and the other person is receiving. So there should be one sender and a receiver. Basically speaking about a definition or kind of thing, I'll be going with like there will be a sender and a receiver. Okay, so there will be an information just passed through. Okay, so that is basically a communication means. So communication in palliative care. So communication in palliative care is an important aspect because everything starts with communication. We just identify a person who is having a proper illness, like okay, sorry, Ravdeep called. So we just in the chat box. What we say to what is understood must be the same thing. Yeah, of course. And understanding nonverbal cues. Rashmika, thank you so much. So communication in palliative care. So moving along, it's very simply like the other definition goes like, in one side, there'll be a patient and families. And on the other side, there's a palliative care team, like a volunteer doctor or nurse or a social worker. or any person related to a palliative. So between these two, the patients and family is having queries, and the palliative care is having some answers or some interventions to that. So first, when we consider the patient and families, you can see there will be uncertainty, fear, and anguish. So these are the things. These are very little things, like only just few points. But we all know that there will be so much problems or so much things that are going through their mind and their environment. So these are the things that is going through their mind, and they want to get answers for uncertainty, fear, anguish, and all. So what we do as a palliative care team will be the persons to clarify that issues and acknowledge the suffering. So this is basically what happens in a communication in palliative care. Okay, so continuing, for patients, we can speak about, I don't want to mention about the patients. Naturally, we don't use patients. We will always call them as the caretakers, like those who wants help. And I'll be just putting it as patients only. So just please just ignore my word like patient. Okay, sorry for that. And for patients, the first thing will be to express the needs or concerns, because a person with so much suffering will be he will be just closing his lid onto every person, and he or she will be like, I don't want to tell anything to anyone, because they don't know exact things. For expressing that need or concerns, that's the first thing for the patient. Okay. So next,
Can we put all participants on mute?
of course. Okay. So then next one is reassurance and realistic hope. We know in a palliative care, there'll be persons who's suffering from a serious illness. So there'll be a case where they're not having a realistic hope or reassurance. So this is the one thing they will mainly focus on, because they don't know what exactly next is going to happen. So that reassurance and realistic hope needed to be given to them, and that will be their second concern. First will be the need and concerns will be shared. Then they need a reassurance, like what will happen next and what can be done. So this is the second one. And next going is to give a sense of direction for patient and family. So they know, the patient and the family know what direction they need to go, and how it can be treated, or how it can be cured, or how the very next step should be taken. And to ventilate feelings. We can know that not in the case of any serious suffering persons, in day-to-day life also, we are also suffering from a lot of pressure, a lot of anxiety and everything. If you consider one person, he's suffering from illness, and he is surrounded by his own problems and his own environment, which is not suitable for him at that moment. So he'll not be able to ventilate his feelings. So this is where it helps for them to ventilate their feelings, to help or guide them in decision making, to guide them to make a proper decision is an important factor. Because in some cases, they're not able to take a decision. When you consider one patient and he's having two children, and he was the only sole breadwinner for the family. And when a serious situation comes where he must take a decision to take a treatment or to take care of the kids or not. So that's where they will choose, or that person will choose their kids over his treatment. So this is a place where a proper decision making should be done. So with the help of a proper communication, we can help or guide them to take a proper decision. Then to clarify doubts and baseless apprehensions. because in more cases, the person or the patients will be in a dilemma like, is it curable, or how can I manage this, or what are the treatment methods, and how can I get this service from the government or from the private sector. So there will be a lot of doubts and there will be baseless apprehensions. To clarify all this communication will help for the patient. Then the last one will be assisting for coping with bad news. This is an important factor because we know that in day-to-day scenario also, if you're coming across the bad news, you don't want to hear it because there are so much people who knows how to convey this. But when we just consider the person who's having that knowledge, it's very less. And in some cases too, there are persons who in the neighborhood also, they will come and tell, okay, oh, this is the case, okay, oh, so I don't know how long can you survive with this and all. So they will be in a dilemma like how they can overcome that, and they don't know what exactly is going to happen. So we can assist them for coping with that bad news. So that help could be given from our part. And that would be the beneficial part for a communication in palliative care. So these are the aspects when you consider related to a patient. Okay, so as I said earlier, we can tell like there is a sender and there is a receiver. So here, the patient's side of point of view is discussed. So there is another person or another group of persons that is called us, the professionals or the volunteers or the person who is in the palliative care. For us, is starting with helps to build trust. It starts with help to build trust because we are going to give a long treatment or long sessions for them, or we are just guiding them for various purposes. So it helps to build a trust between that person and the volunteer or the palliative care person. And to understand patients' thought process. We are not well aware about how a person thinks or not, and we are not taken so much psychological classes or everything. So we cannot judge by them, or we cannot just go and tell them, okay, this person is like this, so he is thinking like this. We can't say that. It's a serious process, but we can understand what they are going to think or how they are going to how they are just going through the situation and what will be the thought process. We can just we can just assume that with the help of a proper communication. Because when we are going to one house, we'll be having so much experience before that, and we can just relate to it. But for that instance also, I would say, don't just go with or don't just connect with any other cases or any other persons with that person. We have to just see them as a new person or as an individual. And second one is so to understand patients' thought process, what will they are going to think and what's their thought process on this. And next will be good relationship building. Simply saying, first the trust building, then we can go to like a good relationship building. With that, we can just break some news to them, or we can just give them more suggestions or more opinions about the conditions. Then better compliance with management, how the treatment should be done, or how the medicines will affect, or how this system works. So these kind of things can be tell to them or convey to them in a good manner with the help of proper communication. And then to understand patients' beliefs, values, concerns, and priorities, because we know that we are in a country where we have a lot of cultures, a lot of ethnicity, a lot of values, and a lot of beliefs. So with the proper communication and more time, we'll get to understand what are their beliefs and what are their values and concepts, and also the priorities. And in that previous case, when I was telling about a person who is suffering from illness, who is having children, and who was a primary breadwinner, so his priorities will be, as I said, it will be their children at first comes. So every person's priorities will change according to their circumstances. So we can understand about all these with the proper communication. Then to understand the impact of illness on their quality of life. As you know that palliative care in here in Palliative India, we always say like to improve the quality of life of the patient and the family. So to understand the impact of illness on quality of life is another aspect we can get to know about with the help of communication. And lastly, to provide required information about illness. In some cases, the person will be having more knowledge about the illness, or in some cases, they don't know anything about the illness. And after one or two sessions or one or two visits, we'll be able to know that what kind of information they want to know. If they are very well educated and all, they'll be like asking so many questions. How will I survive? How things have been going on and all. It's not about education only. I'm just saying for an example. And in some cases, they don't want to know about what will happen. So this communication will help us to provide the required amount of information about the illness. So these are the things that will help to a professional. So I'll be going to the next slide. If you have any doubts, just ask me in chat box. Okay. So for the next one is the core principles of communication. So for this, simply saying the first one will be respect the individual. As we know that, as I earlier said in the session, an individual or a person who's having their own dignity. And what we do is taking care of that dignity throughout the treatment or throughout the course of time. So first one will be respect that individual in his own situation. So that's the first one. And then empathy. I know I don't want to just elaborate about empathy. Being in their shoes. That's very simple way to just tell about empathy. Then trust. Be truthful to them. You have to just think of if you're going to tell them any kind of things that will hurt them or not, you have to think twice, or you have to just consult with, or you have to just talk with their family or any other person who is very related to them. And then only you have to reveal all things. And then you can just be truthful to them. Because trust is a thing, if it's broken, it's not going to coming back. So can we get the PDF form of the presentation and recording as well? Pooja? Yeah, sure. We'll be sharing that. Okay, so moving on. Trust is another part. It's another core principle of communication. And then don't be judgmental. We all know that we'll be very judgmental to some persons. If you're seeing a person who is having cancer, then we'll be just be like, oh, this person is having cancer. Yeah, okay. So his stage will be going like stage 1, 2, 3, 4, and it'll be he can't survive and all. But we don't know exactly what will happen next. If it is curable or not, we don't know that. So don't be judgmental. Just think about how they feel and what are they thinking and how that problem can be eased. So these are the 4 core principles of communication. And then we'll be going to talk about the barriers to communication. We know that communication is a big process, and there are so many barriers for communication related to it. Can you say any one barrier to communication about this session? Can anyone?
Receptivity,
What? Can you-
receptivity.
Yeah, of course, of course.
Both are
Language.
talking at the same time.
Yes, of course, both are talking at the same time.
Not willing to listen.
Yes, not willing to listen. Very good. Not having trust. Physical
Language.
Yeah, language, of course. Diverted mind, lack of good environment. Virtual platform makes it difficult. Of course, Rebecca. Confusions. So when I consider this session, the first thing comes into my mind is what can I just go for chat? Okay, the virtual platform makes it difficult. Actually, this was the first thing comes into my mind because I'm physically in another place and you are all just watching it over your phone or laptop or any other devices. And this is the first thing that is a barrier in communication because we can know that with the help of technology, we can use it and we can also misuse it. How means we can just turn off our videos and we can just do whatever we want. We only have to just use our headphones only. So that we can just hear everything and we can think of like, okay, I'm listening to it. So, okay, yeah, it's just happening. So that will be the first one I will just relate with this communication section. And whatever you just pinned in the chat box is exactly it. So I'll be just going with barriers to communication. In palliative care, I'll be just going like, yeah, environment of the class settings also, Wilson City. Thank you so much. Okay, environmental barriers. I'll be starting with that environment of the class settings, of course. So environmental barriers, simply lack of privacy. Because if there are so much person who is surrounded and if you're just getting into a person's house, just imagine you're going to a person's house and you're just watching him or just looking for him for the first time and just getting into his house and there is no privacy at all. And the place is surrounded by so many persons and the person who's suffering is not revealing anything to you. So then that makes us that makes an awkward situation there. You can't ask anything and they're not telling anything. And it will be like, okay, we can't just interpret anything. So lack of privacy is something which will affect the proper communication. Then the furnitures. Furniture in the sense, if the patient is coming to your room or for consulting anything or for just telling you anything, and you're just in a room where only one chair is there, and that person will be thinking like, okay, there is only one chair, so I can't sit. And if you offer them that seat also, they'll be feeling like, okay, I'm sitting and that person is standing there for the whole time. So that will make them more uncomfortable. So furniture is also plays an important role. Then the noise distractions. When we started the session also, in between some of our members also just unmuted themselves without knowing it. And it just made us to just tell them like, okay, everyone has to just mute themselves. So that noise distraction sometimes make a difference to me. And I was also hesitating like, okay, so should I speak or if they want to tell anything to me? So that kind of a situation was there. So noise distraction is also an environmental barrier to a proper communication. Then the fourth one will be a crowded room. We know that in a palliative care setting, the persons or the room which contains so much persons like a doctor, one or two nurses, a social worker. Here we call them as social officers, or then a volunteer. So if you consider that room, there are so much persons sitting in a single room, and you have to enter with your caregiver, and you have to tell every details in front of everyone. And they will be like, a nurse will be taking that medicines and all, and the doctors will be like asking you questions, and the social worker will be talking to your caregiver, and the volunteer will be looking to like, okay, so what should I ask? So where I can find some time or space. So that will make that is actually a problem for that for communication. So a crowded room will be very, it's not very easy to handle that situation. So the crowdness and the lack of privacy, it makes that lack of privacy also. So, so I'll say these four things, like lack of privacy, furniture, noise distracting, crowded room, also make as also like also comes as a barrier for proper communication. This comes in environmental barriers. Then we will be coming to next. I know that there are a lot of things in environmental barriers, but we are just talking about these four things. And from Rebecca Stanley, I think respecting privacy, a conductive place, conducive place. Chat. Okay. Respecting privacy, a conducive place, a peaceful environment, and patient listening are key to creating a communicative environment. Of course, Rebecca. Yes, of course. So, so the next one, I'll be relating it with how a patient sees. What are the barriers related to a patient? Starting with reluctance to disclose concerns. If you consider that environmental factors also, the person who is sitting in front of you will not be able to disclose all the contents. So he'll be thinking, he or she will be thinking like, okay, these much persons are surrounded, and I want to just give exact details about all the problems. And they'll be like, no, I don't want to share this. If I get proper privacy with me, I'll just share it. Otherwise, I won't. So that will be the first case. Then, of course, about lack of privacy, it will come under that. Then fear of confirmation of bad news. When you just go to, I'll just share my simple experience of me. I was working here for 2.5 years right now, and this was my first palliative care hospital. Okay, so I was here for the first time, and a hospital setting is really first time for me. And when I came here, I just got to know about so much diagnosis, like so much diseases, like quadriplegia, paraplegia, cancer, a lot of types of cancers and all. And after 2 or 3 months, when I come across a small pain in my abdomen, and I was thinking about what's that actually. And I just went to a doctor here only, and that doctor told me like to take a small test for me. And I was like thinking like, okay, I don't know why they told me to take a test. And then I just went to inquire about what is exactly happening. And I was with my lab test report. And when I was sitting in front of that doctor, I was thinking about what bad news he's going to tell me. And I was tense, like in the whole, like in my entire career, I wasn't being like that. I was like, okay, next what? Okay, if it is any other disease or something, then how will I manage and all? Look, that was case of me, I would say. So that fear of confirmation of bad news was in there with me at that moment also. And after that, doctor just ignored me and just told me just take food on a regular time. It's just an ulcer. So I was like, okay, I was relieved actually. But so that fear of confirmation of bad news is comes for a patient certainly because they'll be thinking like they'll be going through so much bad news. They are hearing everything, and they are like, okay, if this happens to me, if that happens to me, that kind of fear will be. So this will another barrier that they don't want to just ask a doctor, a volunteer, or a nurse for a session because they fear some bad news will be coming up. So they don't be able to cope up with that. So that will be one barrier. Then fear of treatment being denied if they raise any questions or doubts. Simply we know that when we just go, not in a medical setting also, if a police officer just asks you anything and if you just saw a crime or a small incident that happens in the road and you just went to ask that police officer like, what are you doing? And you will be like, no, I don't want to ask it because if in the next moment, if he will ask my license and all, and then after some more time or after 2 or 3 days, if he just shows me with any other situations, just finds me in any other situations, he will be treating me like, oh, you are the person who asked me that questions, huh? So that kind of fear will be in our mind. When we consider that scenario into a medical setting, if we ask so much questions or doubts, we will be feeling like, oh, my treatment will be just denied by that doctor or this person, and they will not be taking care of us, or they will be just ignoring us. So that kind of fear comes to the patient's mind. Then fear of losing control over emotions, because some people are like they will be very stern, where they will be very strong in the outside, but in some cases they'll not be very strong inside. So they'll be thinking like, okay, in front of every person, I don't want to just show my emotions. I don't want to show it. I'll lose control over it. So this thing also, the fear of losing control of emotions is also a barrier to that patient to reveal heavy problems. Then stumped by the med speech, like technical terms. We can say a disease or a name of a disease with like normal words, like, yeah, you have this problem, like you have fever. And if you just go by their scientific names and all, and we will be like, okay, so what are you just saying? You don't understand. It is a big disease for me. And if you just simply think about any scientific names of any flowers or something, and we'll be thinking of like, okay, oh, this is the name. How it is possible? Like it will be a big name or something. So that makes us confused. So this comes to a patient and they'll be thinking like, okay, oh, I'm having this kind of a disease and it's not curable or it's not treatable. And then next, what will happen? I don't know anything. So that med speech or that words, like technical terms, should be avoided actually. From our perspective, should be avoided. From their perspective, they don't want to hear that. If they are very, they just like, they are very research persons and all, they'll be asking you like, okay, how this, and all. If they are not knowing anything, they'll be like, okay, sir, I don't want to hear that kind of a name. I'll just hear some part of it. Okay, just tell me very normally. So these kind of things being faced by us also in here. So we don't want to just go with that speech and technical terms. And here also, I want to just say one more word, like we will say in here, like diagnosis, prognosis. These are the two words we vastly use in palliative care. In medical, these are medical terms. Diagnosis means what is the disease, simply. Prognosis means what will happen or what is the next step or what is the treatment of the disease. So how long they can just take treatment, or what are the treatment methods and all of that. Or how they know, what are the things they know about the illness and all. So if we just go and tell them like your prognosis is very poor, your diagnosis is like this, so they'll be very confused about everything. So these are the things, these are the barriers that is related to issues. Then the barriers related to professionals like us, concentrating only on physical tasks. So this is where we make some assumptions like if someone is suffering from illness, they'll only having physical problems. But in some cases, not in some cases, in most of the cases, the physical pain will be there, but it will be attached with the mental or the psychosocial problems. Because if you just consider, like if you just ask me simply, when I'm having an exam, if there is a cold or a fever for me, then I'll be like, oh, I can't do anything. My head is like, it's in severe pain. I'll be like, okay, I couldn't sleep. I couldn't study anything. So I'm just going to write this exam. I'm really going to fail. So there are so many things attached to that simple fever, like tension about the exam, if I will get a pass mark or not. So what will happen next? These kind of things are attached to that fever for me at that. But when you are having a proper holiday, and then if you have, yeah, of course, how about biases? Yes, of course, biases also. So I'll be going to that in the coming slides. Okay, so when you consider that fever comes in a holiday, and you will be like, your friends will be asking you, are you coming for playing cricket? Then I'll be like, yeah, there is a small headache, I'll be coming. So according to our environment or according to our problems, our physical pains will increase too, in relation with that psychosocial problems. So concentrating only on the physical task will be, I will say, don't ever do that, because we have to just think of their situation and their feelings too. Then making assumptions and judgments like, oh, this person is having this kind of illness, so these are the problems. So this will only be the problems. So don't think like that. Just ask them, what are your problems? And just listen to them. Then lack of training or experiences, knowledge, and skill. This is also important one, because if you don't know anything, then we are not able to just express about that proper thing. If I don't know anything about palliative care, then I'll be like, okay, if someone asks me like, what is the diagnosis and how palliative care works and how can I contribute to the society, then I'll be like, I don't know. Properly, I don't know. Yeah, that will be my answer. Then if you want to train or if you want to take care of them, then we have to be like need experience, and we need that knowledge and skill. Then the appearance. How am I looking? If I'm in a good appearance to them, and did they like me, or that kind of a prejudice comes into our mind. Like, okay, if I'm sitting in a proper position, and if they are just looking at me properly, so these kind of appearance issues will be some kind, like there will be some barriers to us, because if we are not well dressed at that moment, then we'll be just thinking like, okay, yeah, I have to just just adjust my buttons and all. Then I'll be like, okay, I'll be just combing my hair all the time, and these kind of things will be a distraction for them too, and it is also a barrier. Then facial expression. During the COVID time, we all know that we were just wearing masks, so no one can find our facial expression at all. But now, after so much ease in that process, we're like not to using masks and all. So our facial expression tells a lot about us and our feelings too. So we have to be very careful about our facial expressions. So these will be a proper barrier in the life of a professional. And then worried about being blamed or fear of worsening the situation. Because if you don't know what we're going to tell them, or if that affects them very personally, mentally, then we'll be like, okay, I don't want to worsen the situation. Then I'll be blamed, and I'll blame myself. So this makes a problem in just opening up and telling more on that issue to that patient. Then unfamiliar with language and dialect. Actually, we had that answer in the chat box, like the language and the dialect. In Kerala also, we have so much dialects that from a person from the corner side, like from Kasaragod, doesn't know the proper dialect of a Trivandrum-based person. So language and dialect also a problem in communication. Then consequences of ineffective communication. It's a simple one, like so I'll just read out, like may provoke greater problems simply, and hiding the truth often leads to conspiracies of silence that build up to a heightened state of fear, anxiety, and confusion. Because sometimes that silence makes them very much into that conversation. They'll be like, okay, they'll be fearing like, okay, I'm not getting a proper information about that. So there are something is going on, and then it can lead both to mistrust and to a source of stress for them, because they are already facing some kind of physical problems or some psychosocial problems. In addition to that, this problem, like this ineffective communication, will lead them to a mistrust and a source of distress to them, so stress to them. That can lead to a lack of planning for the future. With an ineffective communication, we don't know what to plan, because if I want an iPhone, and the person in front of me is just not getting what I'm telling, and he's just suggesting me an Android phone, then I'll be like so dissatisfied with that, because I want an iPhone and they're giving me an Android. So that will be a problem for the future, planning for the future. If they want only treatment, then we have to focus on that. If they want, if they want any help in regard to their children or any other psychosocial problems, then we have to think about that only. So the ineffective communication will lead to a proper planning problem. So these are the consequences of ineffective communication. So Kalpana Gupte, okay, sometimes the patient is so weak that what he is saying is not clearly understood. Of course, the physical problems will lead to so much problems. Thank you, Kalpana. Then moving on, distancing tactics. If we don't know any proper things about palliative care and all, then we'll be like make some distancing tactics. So this is where you had a question, like you had a small portion where some biases and all. So here are the things, the different tactics we use during that conversation or communication. First one will be the categorizing or labeling. We'll be saying like, okay, she is the breast cancer. He is a difficult patient, so we can't handle them. And we just categorize them or label them as into one category. So we'll be treating them like, okay, this person is having this much problem only. So that's one thing. The second will be paying selective attention to safe physical aspects, because we don't want to just get involved into any other, like if a patient just tells them a doctor or a volunteer or any person like I'm so worried, I can't sleep properly, I also have pain in the back. But if we are just selective, and we will be just asking them like, tell me about the pain. In this conversation, you can see that the person is telling, I'm so worried. So there is a worry, and I can't sleep properly. So there is sleeplessness. Then he's saying, I also have pain in the back. But the doctor only asks about, tell me about the pain only. Okay. So he's only focusing on the pain. not the other two facts, the sleeplessness and the worry, the problem. Maybe these two problems, or the first problem, the worry about some problems in the family or something, will lead to sleeplessness, or then that will affect in the pain in the back. So we don't have to take a safe position in that. We have to just explore every aspect of it. We not only okay, sir, please explain the one puja. Okay, so the first one, categorizing or labeling. We don't need to categorize that patient in one category, because if I'm just coming and I'm telling you like I have this problem, you don't have to be like in a prejudiced phase like, okay, so the person is having this problem only, he's having only breast cancer. So we only have to focus on the aspects of breast cancer, and we only have to give them treatment related to that. But we have to be like, we have to ask them, what are the other things? What are the other pains you're having? Or what are the things you suffer a lot? We have to explore more about it. We don't have to categorize them into one. Okay. And also the second one, like he is a difficult patient. If a patient comes to you on the first week, and there will be one nurse or any other person, and they will be saying like he's very difficult, he's very rude to us, and he's having. I don't think he's having so much pain, but he's extremely. There are so much pain in his back and that nurse or that doctor or any other person will pass this message to another person, and he also will be thinking like, okay, yeah, um, so that person is very difficult, so I couldn't able to handle that person. So this thing should be avoided. That's the first one. Okay, Pooja, are you okay? Yeah, okay. So the third one will be never inquiring beyond the physical. How are you feeling? How have you been coping? And in this also, the questions will be like this, like how are you feeling now, and what are the problems you're facing now, and what's going on with your family, and how your family members are doing. So these kind of questions should be asked. Beyond physical, you have to ask about them, ask about their family, ask about their other problems. We have to focus on every aspect. Then using leading questions. 1 second. Okay. So using leading questions is also a distancing tactics. Yeah, of course, we've got encouraging conversation, open-ended question. Yeah, of course, it's very, very needed in a proper communication. Then using leading questions like your pain is better, isn't it? This one only means that we are just asking them about the pain, and we're just telling them, okay, it is better, isn't it? And they will be telling like yes or no. So it's a leading question. If you ask them, how are you now? How are you coping? Then they will be like, doctor, my pain is just reducing, and I'm just feeling good, but there are some problems. So that's the way of asking. You don't have to use that leading questions. Then using closed questions, like, do you have pain now? Then they will be giving you answer like yes or no. So we are not getting proper information. So we have to go with open-ended questions. So then premature normalization. Don't worry, anybody in your position will say no, absolutely no. Anybody in a person's position will not feel the same, because every individual is unique. So don't distance with that. Premature normalization is not active for the communication. Then steps to effective communication. Here you can see with this, just going very fastly, like 7% spoken words are only there. Then 38% voice and tone matters in a communication. Then 55% body language. If you're like you're not leaning towards that person, and you're just looking around, and if you're just playing with your nails and all, or if you're just playing with your like a pen in your hand and you are just rotating it all the time, and it will be like they will be distracted by it, and they won't be just express everything. So these kind of things really matters. Then the step to effective communication. The first one is building a relationship. Simply saying, when a person comes, you have to build a relationship, a rapport with that person. Then only you can just explore every aspect. Then open the discussion. You don't need to just think, okay, like that person will be opening that discussion. No, you just have to just open it. Like, hi, how are you? How are you doing? What's your name? How are you coping up? Or what's the problem you're facing? How can I help you? Kind of a question should be asked from your side. Just open a discussion. Then gather information. Gather information as much as possible. Because these information that you just collect from the first phase of communication will lead to a proper planning. Then understand the patient's perspective. Just listen to them talk. And what they are just thinking about their illness, their problems and all. Just go into that and just understand what they are just telling you, their perspective. Then share information. And I would say share information if needed in the first communication, in the first place. And then arrive at agreement on problems. This is also an important one. With all this, like building a relationship to share the understand the patient's perspective. With coming all this, you will be arriving at an agreement on problems and plans. How could be done? What should be done? How long it will take, and all. Then last, close discussion sense. It's not like I'm just getting late, so we'll just talk tomorrow. No, it won't be like that. You have to give them time, and you have to tell them like, okay, okay. So what's next? What do you want to ask me? If there is nothing more, then we can just end this conversation. Then we will be having a conversation on next day or on this time. So that will be properly closed. Then about what families wish to filter information. This just go through it. It's not. I won't say that it's a big process. I'll just read out. Don't simply respond with "it's their right to know" and dive in. If they want to know, they will just ask you. Otherwise, don't just barge in and don't just tell family the whole information. Then recognize valid concerns about patients' capabilities and past behavior patterns. Then explore families' insight about the illness. Insight means what do they know about the illness? If they know about the name of the illness or not, that is called the insight. So explore families' insight about the illness. Then facilitate conversation between family and patient. If there is a problem, if they are not talking in a proper way of talking, then we have to just facilitate that if they want. Those two person need it. If they want it, then we have this facility. Then share information as it becomes necessary. As it becomes necessary only. Then share. Okay, this is a balancing act from the yes, of course. Yeah. Then handle sensitivity. So these are the things when you consider the families. Because we have to share information very sensitively and we have to handle it properly. And so I'll be going to the next slide. Okay. Yeah. So good versus poor communication. So this is classified into 4 parts: verbal do's, verbal don'ts, non-verbal do's, and non-verbal don'ts. So in this verbal do's, greet the patient and family. It's as simple as it is. Greet the patient and family. Then introduce yourself, like what are you doing, and how, what are you going to just explain. Okay, so Manasi is saying, okay, sorry, leaving meeting due to some unavailable. Okay, okay, Manasi, okay. Then Dr. Pankaj is asking with whom we can't share information. With the person, the patient, or the family member. Yes. Yeah. Of course, with patients without families concerned, of course. because in some cases the patient will be like in a phase like they want to know it, but their family is not willing to just tell them. So we have to take the consent of both family and the patient, of course. Then we have to reach an agreement with the family, like whether we have to share or not. Then only we can share. Yeah. Then verbal dues. After introducing yourself, then ascertain the identity of those present. Because who is who and what are they doing and all. Then use open-ended questions. Never ever ask closed questions because that will just stop that conversation. So use open-ended questions. Then encourage the patient to speak. It's not like just tell them just speak. No, just make an environment where the patient will be feeling like, okay, yeah, I can speak. If they are not very comfortable with that family and all, then you have to be like, you have to just tell the family to wait outside, then give some space for that patient, and the person will be opening up. So these are the verbal do's we have to do. Then repeat important information back to the patient for confirming. Yeah. Repeat the important information back to the patient for confirmation, because when we just repeat that information, the person will be telling you like, okay, yeah, yes. If it is wrong or if it is mistaken, then they'll be telling you back like, okay, this wasn't I was telling about them. Use empathetic statements when appropriate. Okay, then use pauses when appropriate and be honest about information to be given or lack of information. And whatever you are giving, you have to be very clear that you don't say a bit higher or bit lower. You have to be on the exact pace. Okay. Then pausing is needed because they don't want to hear everything from you. They just want to just reciprocate from the conversation. Like whatever they hear, they will just tell you back. Then empathetic statements means it's not like we don't have to be using that sympathetic word like, oh, you're feeling that. No. Yeah. Then you have to be like empathetic, like, okay, yeah. Okay, you can tell me more about your concerns. Yeah. Okay. I do understand. I won't say that I will help you properly. This problem will sorted out. No, I'll just guide you whatever I can. Okay. For what extent? So that things can be shared with that person. So this is a verbal do's. Then we are going with verbal don'ts. Avoid medical jargon or vague terms. I have already told you about medical words will be very crucial, and this should be avoided. Then avoid inappropriate humor. In between a conversation, if you use some kind of jokes that was not appropriate, then they will be feeling very discomfort. Then avoid ending the conversation suddenly. Like if I just tell you like, okay, it's time is up, so I'll be just ending the session. It won't be a yeah, I have to just tell you like, okay, I have to properly close this conversation. Then avoid comparisons. You don't have to compare that person with his family members or any other persons, or you don't have to compare them with yourself. Then do not give premature reassurance or false assurance. Like what I said, like how far you can just handle, how far you can just help them. You have to tell them. These are the things I'm able to do. And these are the things I'm not very sure about. You have to tell them properly. Then do not ask leading questions which will hurt their feelings too. If they are having any marital issues and all, if they are not feeling very comfortable with that questions, you don't have to just ask them. You just have to just stop there and you have to just think, just ask any other questions that are very relevant and that will be very useful. Then non-verbal cues. It's like first one will be simply eye contact. If I'm making an eye contact with that person and they will be feeling, okay, yeah, this person is listening to me properly, so I'll have to just share that information. And then pleasant or warm facial expression. You don't have to be in a place where you're just making your face like in a serious face. If they are telling you any serious issues, then you have to be very keen into that sense. And if they are just making some kind of funny things, then you have to be like not properly laughing at them, just smiling at them. So that are the things needed. Then leaning forward. If they are, we know that they are having some problems to sit in a. So we have to be like lean forward to them. So they feel like, okay, yeah. So he is listening and he is giving priority to me. Then respect the patient's need for personal space. You don't have to just barge into their personal space. You have to be like, you have to ask them permission, like, okay, so this is your social space. Or, okay, so I'll be asking you some questions related to this. Can I just ask you some more questions related to your personal things? Then if they say no, then that's a no. You don't have to just get into it. Otherwise, you can just ask them with getting permission. Then smile and touch, use it carefully and appropriately. If they're very good and good with your presence, and if you feel like to use a small nod on their head or in the hand, just ask the permission, can I? Then if say no, then you don't have. Then last one will be listen. Listening. You don't have to be like, you don't have to ask everything and all. You just have to listen properly. Then only you can gather information. Then the non-verbal do not stare at them. Do not stare at them. And then do not break into the patient's comfort zone. If they are feeling uncomfortable, you don't have to just get into it. So you have to be just in an outer form. Just don't get into that comfort zone. Then avoid unwelcome facial expressions, like if you are just making, if you have any pen in your hand, you're just making it, and you're just pinching it in your face, and you're just doing like this, then they will be like, okay, these are unwelcome facial expressions. You don't have to do it. Then avoid indifferent, angry tone of voice, even if the patient displays indifferent or anger. If they are just showing you some anger in front of you, it doesn't mean that they are very angry at you. They are just anger with their own problems. So you have to be very calm. So then we'll be going to factors helping active listening. First one will be simply nodding. Whatever, if they are saying something, nodding will be the first one. Then reflecting back. If you don't reflect back, they'll be thinking like, okay, you're not listening. So you have to reflect back. Then lean forward, which I was told earlier. Then paraphrasing. In between, if you feel like paraphrasing, yeah, you can. There is no problem. Then, okay, these are the things help in active listening. These are the 4 things which will help you. Then we'll be going to the next one, listen. Not passive, but actively. And also explore using open questions, means open-ended questions. So listening is an important factor. Because in some person's life, they don't have a person to listen. They don't have a person to share anything. So you have to be that person, that you have to show them that I'm here for you, that I'm listening. So you have to listen. So that's the first thing for communication. Then we'll be going to next. We are just on the closing phases. The factors helping active listening, simply saying simple language. Don't use, if they are not comfortable with English, just go with any other rural language that you know. So simple language, use the simple language. And if they are not used to any English accents, then you have to just tell them very simply, very simple English. Okay, then emotional stability. You have to be very stable with your emotions too. Then clarity of responses. You have to just clear your part, and you have to clear all your responses. Their reflections too. Then the time and confidentiality. You have to just keep in mind what's the time now, and how things are going on, how long it will take and all. Then you have to be very confidential with talking. Okay. And then genuineness. They have to feel that you are very genuine to them, and they don't need to feel like, okay, you are just being a person here and you're just telling some other things randomly in between the conversation. They don't have to feel that. You have to be very genuine with them. Then the acceptance and trust. You have to accept that person as as an unique one, and their problems are very unique to them. So you have to accept that, and you have to build that trust. And the last one, simply empathy. So these are the factors helping in active listening. Moving on, remember the following factors. Simply remember, establish good rapport through effective communication. So you have to establish that good rapport with the effective communication, then reduce barriers to communication and practice time management, then use positive non-verbal communication always. So remember these following things in a proper communication. Okay. So I'm just ending with this note. These are the words which came in Hippocratic film that was taken documentary taken on Dr. M. R. Rajagopal, Padma Shri Dr. M. R. Rajagopal. We actually call him Rajsa. So it's easy to destroy somebody with a few words, and it's also easy to lift somebody up from the depths. So it's these words are having so much power, because we can just destroy a person with some words only, because we know that words having so much power, and we can also, with the proper communication, we can easily lift somebody from their problems and all. So with this, I'm just ending my session here. So I think I've given you proper details about how a communication works in palliative care, and what are the things needed to be taken care of while you communicate with a patient or any other persons. I know that this is not only in the case of palliative care only, because in our day-to-day life also, communication is equally important. So in some areas also, if you're just going through any kind of problems or any communication gaps and all, just go through this and just think about what the other person is thinking and what other person is going through. So then you just get a proper information about what they are thinking, and you'll be very calm on your words, and that will make the difference. So thank you so much. So this is the end of the session. So we'll be going next with our discussion and questioning session. So if you have any doubts and all, and you can ask very freely with the help of chat box or unmuting us. No.
Thank you, Sarath, for that very beautiful presentation. So as you've already said, so the floor is open for questions. Please go ahead.
Thank you. Can I go first? Yeah, this is Ravdeep here.
Yeah,
So
yeah,
thank
please.
you. I think you added a good structure, right? We experience all of the aspects you've covered in the communication that we do, but you really put a lovely structure to it. And we can be more mindful, right, when we now communicate. Yeah, but just also wanted to know, for the benefit of all of us, will there also be a session in terms of more information regarding all the diseases which come under palliative care, like a role play or a real session where we can, experientially maybe know all the talking points?
Yeah, actually, there will be sessions. I think psychosocial aspects of care is coming. Tomorrow there is a session, and there will be case presentation. No. So I think I think that kind of sessions will be coming under our FCPC.
Yes.
And in FCPC course means Foundation Course in Palliative Care, and
We'll be giving a brief around about our foundation course in palliative care, psychosocial interventions, which can be taken for volunteers and also for MSW graduates. So we'll be giving a brief in the last session regarding the books. So if you are interested to join for that, you can get more learning things and more outputs on this.
yes,
Sir, ma'am, can I ask one thing?
yes.
Thank you, sir, for a very good presentation.
Yeah.
You have covered very diversified dimensions of communication. I just wanted to know, sir, like, for example, if I'm a counselor and if I have to break the bad news to the patient or to the family,
Okay.
then first of all, it's a major challenge for me as well, no? Like, because as counselors, when we are confronted with death news and communicating that death news, so as a counselor, what kind of you know uh, inner strength is required, and how do we communicate that in terms of, because patient understands our non-verbal cues, patient understands much better, I think. So what would you suggest for a counselor's non-verbal communication and the way counselor has to first break the bad news? What would be your suggestion, sir?
Thank you, Vinita, for asking the questions. If you ask this question to our beloved Dr. Raj also, he'll be saying like, it's very difficult. Actually, it's very difficult. So it's a process like, how will you handle that, and how much experience or how much information you have gathered about that patient, and how are you connected with that patient. I've gone through a procedure like how a communication starts and how it goes to various stages, and how you can just go through, you can just reveal all the news. For that, I think the first thing will be a proper knowledge about that person needed. And then you have to make a proper rapport with that person. Then you have to know how the person will be coping up. If they're having family members and all, then you will be like thinking like, okay, the family members are there and they can simply just help him out of that situation. But if that person is living alone, or he's not having better help from the family, then we have to think twice. Because if we tell them, then he's not getting enough help or support from the family also, then we have to be very cautious about that situation. By knowing about the proper details about that patient, you will get an idea like if that person will be able to take that information. Then only you can just give that bad news or just break that bad news. As a counselor, I know that it's very difficult for us. I'm also a social officer here, so community social officer here. So I've been worked with patient welfare for almost 2 years. And in this regard, what we do is, with the help of a doctor, nurse, and a social officer, look, and whoever is comfortable or whoever is more good with just opening up that type of conversation, that's the first thing we will choose. If that doctor is okay, is good with just opening up that, or the nurse is good with that, then we will go like that. If that person like is not very comfortable with you or any other person, then you have to just avoid that person. Then you have to make an environment like where you're just going to share all the things. Then you have to be like, you have to ask them like, okay, these are the things they're going to just discuss about. So are you comfortable with this? And you have to just make them feel like, okay, these are the things that's going to happen. Then only you can just break the bad news. But it's not like you just go in and you just tell them all the details. No, it's not. You have to make an environment, and you have to take further steps for that. Further steps means it will take time. If the patient is not willing to understand everything, then there is a problem. if the person is okay with you and he's just understanding, okay, yeah, these are things you're going to just tell, and then we can just share that. So it's a complicated process, I would say. As a team in here, we are just handling it properly. But as an individual, we'll be need guidance and we need proper information about the patient.
Thank you, sir. Thank you
Yeah.
for giving a very simple answer for a very complex question, which I appreciate. Thank you so much, sir.
Yeah, okay.
Sarath, can I add something?
Yes.
Yeah. So I just wanted to tell everybody that, I think my experience is that it depends on the situation and obviously what is your relationship. So I'll just quickly take 2 minutes to share my experience. So my younger brother was detected with cancer. So you can imagine how difficult it must have been for all of us in the family to, tell him that everything is okay. We can't say that. And also we can't tell him that he's going to die. So when he used to, because I can see there's one message in the chat box that I came across a patient where she asked me, am I going to die? And my answer was yes. She got tears. So it's difficult, like, when it's your own brother or your own family member, how are you going to deal with that? So there is no, handbook. It has to be customized. It has to be, situation based, and you have to really deal with that. Don't you agree with me, Sarath?
Yes, of course, I agree with you.
Yeah. So that's how I just thought that, this is a experience, and we finally lost him. So I just
Yes,
wanted
ma'am,
to.
like even in my family, I have unfortunately two of my closest uncles died because of cancer, and one of my aunt, though she did not have cancer, but she was in a very, very critical state at a very young age. So I know it is emotionally very, very draining as a family member.
Very
And
true.
I completely agree with you, ma'am, that there is no fixed handbook for this situation, your relationships, your approach, your family background, your economic strength, all these factors come into picture. Thank you, ma'am. Thank you so much. Thank you, sir.
Yeah.
Yeah, and I think Prashant sir has written that she was my mom. So now we got to know that he's talking about his own mother. It's so difficult, right? Yeah. Thank you. Thank you, everybody.
So I'll just go with some chat box. Okay. Awesome.
Sharath, I have a question. Somebody's asked me to share how I handle it.
Okay.
Yeah. So can I go for it?
Yeah, just one question, just 1 second. So there has been like, what is paraphrasing? So that was the question. Actually, it's not related to our communication session, but it's related to proper English. So paraphrasing means that you're just giving them the summary of what they have said, and you're just repeating it, and just telling them, okay, oh, this was happened. So then they will understand, okay, so the person is listening and all, and then they'll just reflect on that. So that's basically actually paraphrasing. Then about yeah, what is diagnosis? Another word, yeah, Shivarani actually replied to it. It's prognosis. And then okay, I came across a patient where she asked me, I'm going to die, and my answer was yes, and she got tears in eyes. Was that right? If you feel that what you said is right in that situation, then it's right. You don't have to feel guilt about that, and it's like what you said is with your knowledge and with your experience with that person, with your communication. So that means if whatever you said, if you think it's right, then it's right. That tears is an after effect. Okay, it will come in any stages. So that's not a problem. You don't have to just push on yourself, Prashant, actually. Just go with it. No problem. Then, yeah, okay, Sunanda, you can just.
Okay, so just to continue with my experience, I just want to tell you that when this happened in my family, when this news was given to us, just like many of you here, I was also new to, I was unaware of what is palliative care and how do we deal, because it was first of its kind. He was the first person to be detected with this kind of disease, so we didn't know what to do. But he was very close to me. So he was like every time asking me many questions. And trust me, I want to be very honest with all of you. I lied him like anything. Nothing will happen. You'll be fine. So now I'm realizing that, I was just giving him very lame hopes because I didn't know. I was not trained. I didn't know what is palliative care. I didn't have any idea. So that's the reason when I joined Palliative India, this was my first blog that I wrote about my brother, that and if I had just known about it, if I had some idea about palliative care, maybe I would have handled it much better. The only thing that I did without even knowing palliative care, I just thought when we were sure that he's going to die. So I just wanted to understand what he wants. He wanted to meet some of his friends, some of our close relatives. So I managed that. We all got together and we tried to bring them all together, and he spent some good time with them. And now I'm relating that, yeah, this is also a part of palliative care, that in his end days he should do whatever he loves to do. He also told me some good recipes that he loved, so I cooked for him. So it was a kind of very, very sad situation, but now I think I'm better equipped to handle things because I know what it is, and I'm working in this particular setup, and I'm not a doctor, but I have got a lot of training, and I really learn every day from all my colleagues and from all of you also. So that's how I handle. Thank you very much.
Thank you, Sunanda, actually, for sharing all that information. And I want to just reflect on what you said. The first thing will be whatever happens to us in person is very different to whatever happens to others. That's a human thing. If I know everything about palliative care, and if something happens in my family to my beloved one, then I'll be like in a position where I couldn't handle proper. I'll be like, okay, I'll be having thinking like, okay, so these are the things to be done and all, but my emotions will overcome this proper knowledge. So whatever you have done is actually very courageous one. Okay, you just make that person in your life very important. That's why you just told him like the lame ones. Okay. So now also I feel like whatever you did at that time was necessary, and now whatever you are doing is actually necessary things. So keep going.
Thank you, Sarath. Any more questions or any other doubts, or anybody wants to share? I think we just have a few more minutes if anybody wants to share anything.
Nanda, hi, nothing to share, but I just wanted to check with you if there is an option to send the recordings. I would like the ones from yesterday as well as today, so that I can revisit it.
Sinia, is it possible?
The sessions are being recorded, so if they want it, so we can just
Like we will be sharing all the learning materials, including the session links, video links. We will not be sharing the video contents directly. We will be sharing the video links, so you can access it from YouTube. So all these learning materials will be uploaded to the LMS IACO platform, IACO.org. So you can download and keep it.
Oh, thank you very much, because I was waiting to re-listen to yesterday's session also, actually. Thank you so much.
Anyone else? We have
Okay.
5 more minutes.
Can I come
please.
in?
Yes, please, sir. Please.
I don't know, but I never knew that this is a term palliative care. But I'm always engaged in these activities without knowing about it. The problem with me is I must have handled over 35 years, around 100 or more cases, I don't know. But then it is giving a deep impact on me. I was getting so much involved with the patients that something goes wrong or if he's suffering, when I start getting feeling sad about me. So how do you avoid this situation?
Can you just repeat that one more time, Umesh?
See, basically, I'm in a medical field since 43 years. And because one of the very few people in the family in the medical field,
Okay.
I used to counsel many people without knowing the term palliative care. Okay. But
Okay.
what was happening with me is when I used to come back from my family members or friends' home, I used to get depressed. So how do you safeguard yourself from giving, while safeguard yourself?
Okay. So for that, I would say only one word, that's self-care. So self-care is something that we need to practice on ourselves, because in this era, actually, you're just dealing with. Actually, I heard about 43 years of experience in medical field. Is it right, Umesh ji?
Yes, he said more than 40. Yeah, yeah, that's correct.
So I think it's a very stressful thing because we are just going through everyone's problems and all, and without knowing it's proper palliative care or not, you're just giving them the guidance and all during these whole years. So that's very commendable one. But what happens is that when we are just dealing with so much problems of others, we will just forget about ourselves, our problems. So in that instance, you will be feeling like I'm feeling very stressed, I'm very depressed, and I couldn't handle this more kind of feeling will be there. So in this scenario, you have to think about yourself properly. You have to take self-care a serious matter. If you're not sorry if you're not able to properly handle or properly just take care of yourself, then we all know that if we are not able to take care of ourselves, then we are not able to take care of others too. Because in this situation, whatever we are going through and all, uh, it's very difficult for us. So first thing will be self-care, and the second thing will be you don't have to take all the things into your mind. It's like we are just going through all the stories and all. Whatever we are able to connect them, whatever give them, whatever we are able to just guide them to, that's okay. After a point, we have to think like, okay, this is the thing we can do. After that, it's not in our hands. Then we have to just give the reference to any other persons, those who are able to just do that. So that will be an important one, because we are just getting very much stressed into ourselves only. If we think out of the box, then we have to be like, okay, if you are, this is my way of doing, or this is the part where I have to say, like I have to refer someone else who is capable to do this in a proper manner. So that would be better. So these will be the two things. First will be self-care, and second will be just refer them to any other persons who is able to do that. And
Yeah, can I just kind of add to that?
Yes.
Yeah. So yeah, I think you said that so rightly, self-care, right? So I just wanted to tell Umesh bhai, there's also one meditation which goes a long way. That's like a tool helping you in that self-care, which helps you detach, right? Like you said, otherwise you hold it in your mind. So I would like to share that maybe on the group or Umesh bhai separately with you, which we've been practicing, which helps you do what you really need to do, but still be detached in a way which will not impact you negatively. So that's like a recommendation, yoga meditation. It goes a long way. Just wanted to share that. Yeah, thank you.
Thank you. So Umesh ji, you were saying something? No, so,
It's easier said than done, but detachment with the attached people is very
Yeah.
difficult to do.
Yeah.
Yeah, okay. But
Yes,
still, nonetheless, I definitely take the help. Okay. Thank you.
yeah, thank you so much, sir. And then there is a query like, please start session in Hindi language. हिंदी लैंग्वेज में हमारा सेशन होगा, वो अभी तक हमने शुरू नहीं किया है, लेकिन हम जल्दी फ्यूचर में करेंगे। और राजीव कुमार जी बोलने के लिए बहुत बहुत धन्यवाद। थैंक यू।
अजय जी ने कल भी रिक्वेस्ट किया था और मैंने बोला था कि एटलीस्ट 30 पार्टिसिपेंट्स हो जाएंगे तो हम करेंगे पक्का। सो आप हमारे साथ जुड़े रहिए और हमको पार्टिसिपेंट्स का लिस्ट भेजिए एंड विल प्लान इट इमीडिएटली। थैंक यू।
Abhilash, you have raised your hand, so can you?
Hi. Hello, everyone. So I
Yeah.
just wanted to add to this handling this emotion. My wife passed away about 9 months ago to cancer. So I've been dealing, I've been taking care of her for 2.5 years before that. And I never knew about palliative care that time. And one grave mistake I made is that I used to tell everything to my wife, although she didn't want to, to know the prognosis. But I kept on insisting that she knows the truth. So only after I came to know about palliative care, I understood that it is when the patient doesn't want to hear such news, and we should not tell them. So after that, only after she passed away, only then I came to know. And regarding this getting into depression, I think even now when I'm now visiting people in care with cancer, but sometimes I get emotional, sometimes I get depressed. But how I overcome that is just thinking that it is my duty to help them. So my priority is to help them more than taking things personally to me and worrying about how it affects me. So I take it as a priority to help people. So that in that way, when that becomes a priority, my depression and my emotional, when I get emotional, I'm able to really process that and get everything in control. So just wanted to add that. Thank you. Thank you very much, sir, for your session. And thank you, everyone.
Yeah, thank
Abhilash,
you.
if I can just step in for a minute and just comment on what you said. I think what you did at that point of time was what you thought was correct, what you thought was right for your wife. I don't think it's very important for you to beat yourself up for it, because you didn't have, you went with a clear thought and you had no malice in mind. That's what I mean to say. You wanted her to face the truth when maybe she wasn't ready. And I agree that even I have got to know about palliative care even just about 4 or 5 months ago. And I was amazed that, despite being a voracious reader and knowing so much, I had no clue about what palliative care was about in true sense. And I agree that there is a lot of, support that comes, emotional support and everything that comes with it. But I think, you really need to accept that what you did at that point of time was something that you did out of, the purity of your heart. So, just don't feel bad about it.
Yeah.
That's all I had to tell you.
Yeah, thank you, Pratibha. Actually, I was also about to tell that because Abhilash, whatever you have said at that moment, you're being truthful to your wife. Okay, that was very important at that moment, and you don't have to feel depressed, guilty about that, because whatever you had done at that time, that you were making comfort, you're making that person in your life very comfort. Okay, and you're telling him like, oh, these are the things I want you to know, all these things. So that's what you did, and it was not like, okay, you're just telling them this is going to happen, and now after knowing so much about palliative care, and you're thinking like, okay, I shouldn't have done that. No, it's not. Okay, so don't ever think like that. And whatever you're doing right now, and you're thinking like, I have to help others, that's the thing actually now motivates me too, because with all these things, after going through all the things from 2.5 years, and after the departure, 9 months something, and now you're in a course with us, and you're just giving awareness to others, and you're helping others, and you're being a role model for us too. So don't feel like that. And this community and this person, we are all here with you, and you just do wonders. Okay.
Thank you for your love, everyone. Thank you.
Yeah. Okay. So anything more to add? So I think we have reached our time limit. So if there
Can
is
I
any,
just share one thing, sir? One thing, just to, I know time is up, just one thing. I have met, I think if Priya can correct me, Raj Gopal, sir, his name is, who is from Hyderabad's Pain Relief and Palliative Care Society. He had a similar situation like Abhilash ji. And today he is doing such a wonderful job, offering lots and lots of his resources, his economic resources, emotional resources. And I think all these people really motivate us to take up things forward, no matter wherever we are, wherever, whatever our situation is. So we have great inspiring stories from people like Abhilash ji and our Raj Gopal ji, who is from Hyderabad Pain Relief and Palliative Care Society. Thank you, sir.
thank you, Vinita. Thank you. Thank you so much, everyone, for sharing everything. And we hope that this session was very informative. And we'll be seeing you on next day. And I think there have been a question about our FCPC course, and we'll be discussing it about it on the coming sessions, like on the ending session. So we'll be having a proper details about that. And you can just, if you want to join, you can join in that session too. So that details will be shared by Senior and our virtual education team. And thank you so much. So if anything needed, just get us through mail or WhatsApp. Thank you.
So more question you can put up in our WhatsApp group. All are welcome to chat in that. Thank you, everybody. And thank you, Sarath.
Yeah.
Over to you, Anup.
Thank you, everyone.
Thank you, Mr. Sarath, and thank you, Simta ma'am. Thank you, everyone, for your participation. Bye.
Okay, bye-bye, everybody. Take care. Bye.